All right, so I believe we're streaming to Facebook, but what I'm going to do is I'm going to press record here anyway. So it's going to be recording regardless, and we can use that recording. So one of the reasons I wanted to kind of get you on here again today, and actually what I think will be a really good thing for me to do, because of course I know who you are, but people watching don't know who you are. So we did a webinar a couple of days ago where we answered all of your questions about the coronavirus and actually went into quite a lot of detail about the gloves and the masks and all of the contraindications. Now, my very special guest for that is Dr. Margo Livingston, who has a PhD in Haematology and Immunology, BSc in Immunology, MSc Advanced Professional Nursing. Seriously, the list is long and it's amazing and it's incredible. And I wanted to speak to someone who actually knew what they were doing and knew all about the virus, because when we spoke, Dr. Livingston, you said viruses are your thing. So that's the reason I wanted to kind of come back to this. And do this kind of conversation. And I wanted to be quite specific this time in terms of the conversation, because we talked about a lot. I know the question of children came up last time, but there was a very specific question that I had, and I'm going to read it so that people can get a sense of what that question is. But while I'm finding the question, Dr. Margo, do you want to do an introduction of yourself? Just say a bit about who you are, what you do, what your qualifications are, and why you are so passionate and qualified for this particular conversation.
Well, thanks, Marilyn. Thanks a lot. It's lovely to see you again. Basically, I started out life as an immunologist, and that was a long time ago when immunology wasn't really known about, but it's turned out to be one of the most vital parts of the scientific study of the body, because the immune system is actually the most important thing to keep us alive, because we're constantly barraged by possible infections in the terms of microorganisms, fungi, viruses, bacteria. And so I've been studying that most of my life, and I also I did nursing because I was living in underdeveloped countries with my ex-husband, and I wanted to be able to help people, and they didn't know what immunology was when I was in Liberia, West Africa, in the 80s. So that's really why I'm a nurse and a doctor. It's a bit of an unusual combination. So I'm fascinated by coronavirus because coronavirus is an unknown entity. It's part of the severe acute respiratory syndrome viruses. And there's only been one other SARS infection in 2003, which caused some deaths in southern China. But this one that we have right now is a much more dangerous entity. It's creating a pandemic around the world, whereas the other one didn't really go all over the world, and it's also very there's no cure at the moment. So that's why I'm very keen to try and help the public or anybody I can help to understand a bit more about it, and what we, to try and allay your fears and not help you to understand and get at how you can protect yourself and how you can look after yourself and your loved ones. So that's really why I'm so keen on talking about this.
Wonderful. And just to give people a sense, if you missed what we did a couple of days ago, so we did it just 2 days ago, but we talked about what you can do when you attract the virus. We talked about how you can protect yourself and your loved ones. Dr. Margo talked about understanding the initial signals and signs and what, and also some of the distinctions between this and the flu, because a lot of people are saying, oh, it's just the flu. So we talked about that. There were people asking about making a more rational scientific choice about travel, the movement, restricted movement. We talked about the real impact and what's going on with the hand sanitizers. We talked about the touching of the face and why that is so key and so crucial in terms of not doing it. We talked about the typical research and testing phase, looking for a cure for this and looking for how to, the kind of what they're looking for in terms of being immune to this. We also talked about Can it be passed from pets to people? We also talked about children, and somebody specifically said one of the child had symptoms. We went through the symptomology for that. We also talked about being asymptomatic and the problems that is creating. And we also had a little bit of a political discussion in terms of Dr. Livingston's thoughts about the country not being on lockdown and the issue of us still kind of moving quite freely. So we covered a lot. If you would like to watch that replay, I will put a link underneath this video once it's gone live, so I'll give you the link for that. And today what we wanted to talk about, somebody was saying that they work in a school. There were children who were fine in the morning, but by midday nearly 25 of them were actually sent home with high temperatures and coughing. One of the things we talked about 2 days ago was the reason why children don't tend to be, you talk about the telomeres and how that works in terms of the virus attaching to them. But with this one, when I read this, I was thinking, hold on a minute. So she's saying that kids are actually coming down with the virus. So my question was, I know that kids aren't the natural target for this virus, but could they be carriers of the virus? And they then go home and infect their families and loved ones. So that's really what I wanted to talk to you about today for this soundbite, Dr. Livingston.
Mm-hmm. Well, it's an interesting question because there is still the jury. I mean, even the experts on the news and on the internet, they're not able to pin down the fact that children are highly contagious to catch this. And what we covered a couple of days ago was that anybody under the age of 20, so from a baby right through to the age of 20, they're very, very low risk of catching it. Now, there's been another baby mentioned that was infected today, a 9-month-old baby that has got coronavirus, and that I saw on Facebook that 21-year-old football coach died of it, but he had underlying problems. I'm sorry, my dogs are
Okay.
barking outside. They're just being very naughty. So the thing about it is that
he had leukemia. So
you can't say that the virus will. Yeah, the guy. That's right. They just said underlying, and they didn't even mention leukemia. Now, leukemia, as I said 2 days ago, is one of the worst possible secondary diseases that you could have in terms of if you meet a respiratory virus and that you have and your immune system is dampened by having leukemia or anything that's going to dampen down your immune response, and you're also on drugs probably to try and combat the leukemia, you really haven't got a chance to fight off other infections. And that's why that poor gentleman did not survive. Now, the fact that he was 21, if he had been fit and healthy with no other comorbidities, no other factors, he would be absolutely fine, I'm sure, and he would have just had symptoms and he would have fully recovered. So the thing, exactly the same applies to children. And to be honest, Marilyn, I find it a bit strange that 23 children in the same class all started coughing with a high temperature in the same period of time. It's really strange to me. And I obviously don't know whether they since confirmed as having coronavirus. Is it? Do you know that at all?
I don't know that. I just saw that one and I thought, now that's interesting given what we said about children. And then that really made me think, okay, so number one, they're not the natural targets, but if they come into contact with the virus, let's say they've come into contact with adults who have it, because the directive now, as you probably know, the breaking news today was that schools are going to be closing from many from this Friday, some from next Monday. Others are going to maybe push that for 2 weeks in some parts of the United Kingdom. And my thinking was, then, right, if they've come into contact with adults who have the virus, could they potentially take that home? Because one of the directives was children are now to keep away from their grandparents, which tells me that it sounds like they're now thinking the children are mini carriers. So I just wanted to get your steer on that one as well.
Yeah, definitely. I mean, the point, I'm not saying they're carriers. I'm saying that they have the possibility of being infected, but they have a much lower risk of being infected than anybody above the age of 20. The child rate of transfer of the virus is less than 1%. So anybody under the age of 20, they have got less than 1% chance of being virus, and that's because their telomeres, the part at the end of their DNA, is very underdeveloped because they're young, and that has been shown scientifically to be the part of the DNA where the virus wants to hook onto, and that's why it's specifically affects people over the age of 50 or people who are chronically ill and of any age, basically. So any infection will attack somebody who has a poor immune system, because viruses are looking to survive. It's a survival game, and they're trying to get into a human host so they can replicate and continue growth of their virus. That's the only way they will stay. They can't live long term outside of a human host. So the viruses are going to attach onto somebody that doesn't fight back, like somebody that's not that's over 75 or over 70. They say over 65, but anybody over 50, sadly, we start to have a more reduced immune response to illness. So I would say the children are not acting as carriers. The children are actually, obviously, if they've got coronavirus, they've got an infection with coronavirus. They're not carrying it. They might have very, very, very mild symptoms. And in that way, you could call them a carrier because they might not even feel ill. But these children that you've been talking about were coughing and sneezing, and I'm just very confused how a whole class can suddenly get sick in a few hours with all the same symptoms. It seems to me more like a kind of hysteria type reaction, almost like a herd reaction. It's very, very strange. I'm very interested to know if they actually were positive for the virus. But the point is that any human beings that are mixing in public, in crowds, in close contact, whether they be children or adults, it doesn't really matter. You don't want that to be happening, because you've got children close together in a classroom. Like we talked about 2 days ago, the dogs have been able to pick up the virus as well. So any living being in the family where there is a virus, the other members of that family have got a risk of catching it. So the disease is the most lethal in people over the age of 70 or the age of 65, people with chronic illness as well, at any age. So if you have a child, they've got less than a 1% chance of catching the disease as far as the research goes up until now. Once they have well, not millions of cases, but once they have collated all the data from this infection in years to come, they'll be much more accurate in terms of how infectious it was and with what ages and what happened to get immunity. But at the moment, we're in the reaction of the virus, so we're in the illness, so we can't really give accurate statistics. But I would say it's a really, really good idea to close the schools and the universities, because the parents are dropping the kids off and they're picking them up, and the kids are in close contact. The teachers are at risk as well. So anything that is a close gathering, you want to try and stop that happening. And as I went on about 2 days ago, the only way we can stop the spread of the virus is to stop people being together, whether it be children or adults, or, you know, it doesn't really matter. So it's almost like an obligation that we close schools and stop children from going. Now, I would urge parents not to think that your children are in danger, because I believe that they're not in danger. They're not in danger of becoming very sick. They're not in danger of dying of this disease, because the disease selectively goes for people that are older or people that are chronically sick, and people that are immunocompromised. So they've got a weak immune system, and the virus can get in and then multiply to its heart's content without being stopped, and that's the people that we really need to be worrying about. So on that basis, if you have children who have got a very mild infection, they can still pass that on to anyone they come in contact with. So you definitely don't want them to be mixing with old people at all. You don't want older people or people with chronic illness to be mixing with anyone at all, whether it be other older people or younger people or sick people, definitely not, or children, because anybody that can give them the virus puts them at massive risk. So it's all about protecting older people. And I want to reassure you that I think your children will be all right. They'll be all right. And my dogs are barking at something outside. I'm really sorry. So Marilyn, does that kind of answer your question, do you reckon?
Absolutely. And I think just what I would say then, so let's just say, because I was out, you know, someone I spoke to today, he said they live in an extended family. So 2 kids are out at school, grandparents are there in the home as well, plus him and his wife. So kids are now at home all day. You live in an extended family. You don't have a mansion where somebody's going to be in the West Wing and somebody's going to be in the East Wing. So from your perspective, for people who are going to be forced into a confined space, and you maybe have the grandparents there or people who are older, what would your suggestions be about how to mitigate that as much as possible and reduce risk factors?
I think, like I said 2 days ago, you have to try and isolate at-risk people. You really have to maximize their protection. They're the ones that are most at risk of getting seriously ill and perhaps dying. So if you have a shared household with adults young who are fit, children who are young and fit, and then you maybe have an older person there, you would need to optimize the seclusion of the older or at-risk chronically sick people. So if there's, you know, if they can have, they would need to have their own bedroom. Where possible, they would have to use their own bathroom. If people are lucky enough to have 2 bathrooms, I would dedicate 1 bathroom to the older or the chronically sick person in the house, and everybody else maybe uses the other bathroom. I wouldn't suggest that. The thing about it is, if you're self-isolating and you've been home together as a group for more than 7 or 14 days, the government are talking about 14 days. Now, the reason they're talking about 14 days, if you think somebody's got the virus within the family group, is that if you are the person that's had some symptoms, for you will know within 7 days. The average incubation period is between 2 and 14 days, but most people will know but within 5 days if they've got symptoms, okay? So if, let's say, you don't show symptoms till the 5th day, and the other people in the house, you've been mixing with them, they won't know if they've got it or not. So that's why the government's asking people to self-isolate for 14 days. And that's to make sure that if anybody else caught this virus before you became symptomatic, okay? So let's just assume that somebody in the house has either got the virus or is very high risk. Try and get them to be very much on their own. Don't let them go out to the shops. You prepare food and pass it to them. Like I mentioned before, I know it's difficult, I know it's a hassle, but try and have them have all their own crockery and cutlery, and do their own washing up, and be in the kitchen or the living or whatever at separate times from everyone else. And you will need to use really stringent hygiene measures, like more than 60% alcohol, or disinfectant sprays like bleach and things. Clean everything, like inanimate objects that everybody might be touching, like the sink, like the handles of the sink or the bathroom, the doorknobs, you know, do that on a daily basis, and clean laundry frequently as well. So you can't have an ideal scenario where everybody's completely separate, but I would say just try and keep the most at risk people the most separate as possible.
And for those who might go, oh, Dr. Livingston, that sounds a bit dramatic, what would you say to that?
Well, like I keep on trying to say, the only way that we can stop the spread of this virus is to stop people from spreading it to each other. And it's a respiratory infection which is easily passed on by infected hands with the virus on your hands, by coughing over somebody or speaking over somebody or sneezing over somebody who is not infected. Very easy to pass on via your face, via your mouth, via your nose, and you can catch it by rubbing your eyes, because the virus will enter any mucosal surface, like nose, eyes, and mouth. So you can't overemphasize how important it is not to pass this on, because your loved ones will be at risk if you pass it on. So I think you just have to accept that this is totally abnormal situation. It seems dramatic, but the only way to stop passing it on and create an opportunity for the health service to cope, virus to be dampened down, because each person who's infected with the virus has the ability to pass it on to up to 4 people unchecked. So between 1 and 4 people would be infected by you if you had the coronavirus and didn't take any precautionary measures. So everything that we're saying is try not to get it in the first place, but if you've got it, you need to not pass it on to other people. So it's not dramatic, it's just common sense. It's common sense, and it's vital that all of us, each individual, is responsible for helping not to spread the virus, and that's what people all around the world are trying to do right now.
Wonderful, thank you. And I know also one of the things we've been talking about is the way that you work in your practice, because you have the ability to work with people globally in terms of, allaying their fears, allaying their concerns. And so do you want to say a little bit about that in terms of, and I will put the slide up so people can see your details, but do you just want to talk about what you do as a nurse practitioner as well, and the way that you can work remotely if people have fears and worries, etc.?
Yeah, like Marilyn said, I produced a fact sheet, which I'm more than happy to send you. If you email me, my email is info@mindsanctuaryuk.com, which you can see up there on the website is mindsanctuaryuk.com, and you can contact me via the website as well. I literally, as I'm an immunologist, but I'm also an advanced nurse practitioner. So that is an advanced nurse specialist. So we are licensed to assess people for any form of medical ailment, whether it be, I'm actually a psychotherapist as well, so I can help people who have mental issues, I can help people with physical issues that are not relating to obviously coronavirus, and I'm setting myself up as an online consultant, ANP. And I think I'm probably hearing that, Marilyn, because it was actually you that suggested that that would be a really good place for me to head, because you can help so many more people if you're global, if you're international, if people can speak to you on Skype. And I can do an assessment, and obviously I can't do a physical diagnosis, but I would make myself available to do face-to-face meetings wherever that was required in the UK, and perhaps in Spain or other places in Europe as required. So I can assess, diagnose illnesses, form a plan of care, and I'm a licensed prescriber as well. So I can give advice on prescribing. I'm looking into whether I can actually prescribe medication as an independent self-employed DNP. I spoke to the Royal College of Nursing today about that. So I'm looking to try and help people who can't get appointments at their own GP. And all GPs have now, since this crisis, have been given the ability to hold video conferencing. And I think it's the way of the future, because it has almost just woken us up to the fact that, there are millions of infections out there that we're exposed to on a daily basis. There's over 340,000 known viruses in the world. And this has become very, very newsworthy because of the fact that it's become a pandemic and it's never been seen, and there's no vaccine. But we need to all look after our health. We need to look after our immune system and boost it. We need to know what to do if we have signs of illness. And you know, if you do have sign coronavirus illness, you would have a temperature. You'd have a temperature of about 37.8, a dry cough, like not a lot of sputum, so just not just an annoying cough that would last more than a few hours, and you would feel tired. So those are the mild symptoms, and then it can get a bit worse if you have chills or aches, if your temperature goes above 37.8, if you have shortness of breath, you need to phone NHS 111 and get some advice about going in to hospital. 80% of people will have a mild illness, and hopefully, we don't know for definite, but we hope that everybody that's recovered will have long-term immunity. So please get in touch if you want a free fact sheet, if you want any advice on coronavirus, and if you would like to have a private consultation, and get in touch as well. Thanks a lot.
Wonderful, wonderful. And I know one of the things, like the fact sheet is actually here. It is seriously mind-blowingly good, and I believe it runs to about 7 pages. So some of it is bullet point format, others is really good information to have, because one of the reasons I kind of suggested that Dr. Margo do this is because I said there's so much information out there. Some of it is fact, some of it is fiction. What I'd like to do is kind of cut through all of that and give people really, really good information. And for those of you who have ever kind of done coaching sessions with me, I always say be careful what you wish for, because I will often, as you were saying on the call on Monday, I do like to see the bigger picture. And when I was talking to Dr. Margo, she's talking about all these wonderful skills and qualifications, my brain is like, hold on a minute, why aren't you out there doing this? And it was even before all of this broke. You know, I'd said to you, I think you can do online consultations. I really see that being the way forward. And this was before all of this broke. And suddenly, like you said on the news now, GPs are doing it. So we were ahead of the curve with the conversation, and me saying, I think you can work with people online. I'm pretty sure if you check the prescribing, you would be able to do things like that. I was also saying, I really think you should be in the press and media writing. And since that, I've managed to secure 2 writing commissions for Dr. Margo. So one of those has already been published. The next one will be coming out soon. So that was just from 2 coaching sessions, because I'm like, I think the world needs you at this time, because you are so full of wonderful information. And so out of that came the webinar and the articles and the fact sheet. So really delighted that people now have access to you and access to this information. And for those of you who kind of, you know, want to get hold of the first webinar, if you're not following me on my traditional channels, feel free to get in touch. You can email me as well, Marilyn at transformationstm.com. Marilyn is Marilyn for November at, and trance, TRANCE, formations, it's F for Freddie, so FORMATIONS, TM is in trademark. So Marilyn at transformationstm.com. This was one of my more unusual in conversation with pieces because of what's going on in the current climate, but these are something that I do whenever I find interesting people that I think the rest of the world would love to hear from. So, you know, keep in touch. I've got an e-newsletter list. You can join that via the website, transformationstm.com. Also follow on social media. Let me just go back to one for Dr. Margo Livingston. It's the Sanctuary_UK if you want to follow on Twitter. You're also on is that the same name for your Facebook page, Dr. Livingston?
Yeah, I do have a Facebook page, the Sanctuary_UK and Livingston Margo. So I've got, you know, my own personal page and then my Sanctuary page.
Fantastic. So do also kind of follow along. Also, if you know people for whom this information would be interesting, feel free to like, feel free to share the video. Definitely get in touch with Dr. Margo for the fact sheet, because it's absolutely fascinating. And I'm sure you will learn a lot from just having a read through this. And the plan is that this will also allow you to be a bit more calm and do what you need to do. So just want to say thank you so much for watching. Thank you, Dr. Margo, for coming for a second impromptu chat. I really, really appreciate it. And is there anything you wanted to say in closing?
Well, Marilyn, I just remembered a couple of things that I think might help people. Since it came as a question on the other day when we had the first webinar on Monday, NSAIDs, so things like Brufen and Naproxen, these non-steroidal anti-inflammatory drugs have been linked to the fact that some of the people that have died of coronavirus virus were not to take brufen, and I would recommend not to take naproxen because it's the same class of drug. And sadly, paracetamol seems to have sold out in the supermarkets, but that's what you need to be taking if you can. And so, as you know, if you have a headache and you have symptoms, that's the kind of analgesia that you should be taking, something simple like paracetamol. And the other thing that was a question from Thomas the other day about how could people seemingly recover, and there's been a couple of cases reported where people have, quote, been reinfected with the virus. Now, the scientific studies have shown that T cells, which are the part of your white blood cells that fight viruses, and the virus, like I said to you earlier, is very, very clever. And it has been reported that the virus, this is here in terms of, it looks like you're better because you're mounting a T cell response, you're mounting an immune response. And once your T cell count diminishes again, the virus reappears. So instead of being reinfected by the virus, it's not that you were better originally, you were just not showing the symptoms anymore, and then it reappeared because it's a bit like herpes can be, where it hides in the ganglia of your nerve cells. So this virus is trying to survive, and it can pretend to be gone and then come back again. There's not a lot of studies reporting this, but it's to answer the question that we don't know yet whether we can have lifelong immunity to the virus. But that was just something I wanted to answer from the other day.
Wonderful. Thank you so much. And also thank you to everyone who's watched this. Thank you to everyone who joined us for the much longer webinar. I think it was about an hour and a half that we did on Monday. And thank you again, Dr. Livingston, for answering my impromptu, "Are you free again this evening?" I really, really appreciate it.
Thank you, Marilyn, so much for the opportunity to speak to everybody. I really appreciate it. And I look forward to hearing from some of you. And please be safe. Take care.
Wonderful. Thank you all, and look out for further videos, etc. But for now, we will end there. And I just want to say thank you so much for joining us. And if you've missed the longer webinar, I highly recommend you watching that, because there was so much incredible information. And I really, the intention of that was to help also put some of your fears at rest and remind you of things that you can do. A lot of the times, very simple things that you can do to help keep yourself fit and healthy and safe, including some things to boost your immune system. So, do get hold of the original webinar as well. But thank you so much, everyone. And thank you, Dr. Margo, for joining me.
Thank you. Bye, everyone. Bye.
Bye. Okay, and recording has stopped. So I'm now going to press the end webinar button. So thank you so much, Mari. I really appreciate it. And
No problem.
Look out for the next impromptu call.
Not at all.
Brilliant. Thank you.
Did it go on Facebook? Do you know?
Yes, it did. I was having a look and it did go.
Bye.
Fantastic. Bye.
See you later.
Brilliant. And it will end in 9, 8, 7, 6, 5, 4.